with L&R, and today we are going to discuss about the new topic, that is restraint. First of all, you know about the meaning of restraint, and it is a device which limits or prevents freedom of movement. And this technique we have to use in the pediatric ward during any kind of examination or procedure when performed on the child. Introduction. All infants and children have physiological and psychological needs to be mobile or movement. Okay. Prolonged immobility of children may result in physiological loss of muscular strength and flexibility. It may also affect the physiological functioning of the body in other ways, such as influencing respiratory volume and peripheral circulation. Psychologically, prolonged period of restraint may result in the child's inability to develop motor and psychological skills owing to lack of motor and sensory contact. Then, the purposes of restraint: to limit the child's movements during procedure that may harm or injure the baby, to provide constant immobilization during the procedure, to provide maximum human contact by using hand restraints to facilitate examination of child or a procedure, to ensure child safety and comfort by using restraint. The principles behind the restraints: it used only when necessary and never substitute for observation. Cannot be used on continuous basis. If used, reason should be specified and explained to child and parents too. Checked frequently to know not causing any side effects. Any required knot should be tied in a manner that permits quick release if the child feels uncomfortable. A mobile child should be replaced the lost activity. Then there are various types of restraints. There is 6 kinds of restraints. The first one is mummy restraints, jacket restraints, elbow restraints, extremity restraints, abdominal restraints, grip with dome restraints. Then the types: mummy restraints and modified mummy restraints. Then jacket restraints, elbow restraints, arm and leg restraints with the help of supplings, extremity restraints with the help of club hitch restraint, grip with dome, mittens, papoose, abdominal binders restraints, and bed cradle or bed with side rails. Then after that, mummy restraints. There are various purposes of mummy restraints: to immobilize of arms and legs for period of time, during examination and treatment of head and neck, during puncture of jugular vein, or during gastric lavage and lavage. Right. Modified mummy restraint may be used when the child's chest to be examined. Then there is a mummy restraint. First of all, we have to separate the sheet, place the child on that and fold on one side. And second time, we have to cover the second arm and from the sheet in the side of the foot that we also covered, and this is a mummy restraint. The next is modified mummy restraints. Here we have to use, or we have to spread the sheet in a triangular manner and fold the sheet on the head side, then place the child and cover on one side, then the another one. After that you have to use the D type, and at the end the modified mummy restraints looks like, which we can see on the end slide. Right. Then next one is jacket restraints. There are various purposes of jacket restraints: to help of the baby remain flat in bed in a supine position during the procedure, to prevent of the baby falling from high chair, or prevent of the baby to down from or fall from the crib. Chances of strangulation with jacket restraints are also there. This is a jacket restraint. Then there are various disadvantages too. Use of the jacket restraints is that of strangulation through pressure of a restraint that has slipped out of place and encircled a child's neck. Age group infant and toddler, we can use the jacket restraints on this age group. Then elbow restraints, the main purpose to keep the elbow in extended position so infant cannot reach the face. After the surgery of the child's face had such as cleft palate repair and during an eczema and skin disorder when introduced of the scalp vein. Then this is a elbow restraints we can see on the picture. After that, extremity restraints or club hitch restraints. The main purpose to immobilize one or more extremities, same as elbow restraint. Other points, applying on wrist or ankle 2-inch wide gauze bandage and make figure of 8, then apply on the extremities. In these restraint chance to cutting off circulation, so restrained extremities should be examined for coldness and discoloration. Okay, then club hitch restraint is clearly seen here. Then arm and leg restraints. The uses of this to keep one or both extremity restrained or limited in motion. The age group neonate, infant, toddler, preschoolers are there. It must be padded to prevent undue pressure, constriction or tissue injury, and the extremity must be observed frequently for signs of irritation or impaired circulation. The ends of the restraints are never tied to the side rails because lowering of the rail will disturb the extremity frequently with a jerk that may hurt. Then supplings. This is a kind of supplings. Crib with dome restraints. If the infant or toddler is capable of climbing over the crib sides, the crib net or plastic dome may be used to keep the child safely in the bed. Crib net should be tied to the frame. The knot used must be of the type that can be untied quickly in case of an emergency. Then this is the crib with dome. Then mittens. It used for infants to prevent self-injury by hands in case of burns, facial injury or operations, eczema of the face or body. Mitten can be made wrapping the child's hand in gauze or with a little bag, putting over the baby's hand and tie it on at the wrist. The age group we have to apply a mitten, neonate and infant. This is a kind of mitten. Papoose cross-stitch tape, specially used in procedures like exchange, blood transfusion, head and chest and abdomen. A papoose board is a device commonly used to immobilize children for dental work, blood drawing and minor medical procedures. The child is placed on a flat board and white fabric straps are wrapped around the upper body, middle body and legs. This is a papoose. Papoose board and arm immobilizer work together to safely secure a frightened child. The safely immobilized children, adjustable canvas straps with Velcro closures hold patient securely to rigid backboard and adjustable head strap incorporated into backboard. Optional arm immobilizing accessory slides underboard for film spread eagle position. Then abdominal restraints are also known as binder. This holds the infant in supine position on the bed. It must not be applied so securely that respiratory movements of the abdomen are inhibited. The age group we have to apply the binder, that is infant, toddler and preschool. After that, the abdominal restraints. The purpose of abdominal restraints, that is to maintain supine position. Other points, keep in mind that child respiratory movement of the abdomen are not inhibited while you are applying the binder. Bed cradle, bed with side rails. A small low bed for an infant or a younger child must have high side rails as a restraint to prevent falling from the bed. The age group infant, toddler, younger child. Then car seat. Car seat belt can be considered as a restraint. And contraindication of this, child too distressed despite adequate preparation, older children with several behavioral problems, informed refusal by the parents, guardian, child, pre-existing medical condition or physical disability or limitation, history of sexual or physical abuse that would place the child at greater psychological risk. Then restraints. Injury to the brachial plexus might be there, sore or gangrene, exhaustion, loss of energy, dislike for the hospital and health team members, physiologic loss of muscular strength and flexibility, psychological hazards and inability to motor and psychosocial skills, difficulty in developing own body image. Then the management, the reason for applying restraints must be explained to both the child and the parents so that both parents and child must be cooperate with you during the procedure. This may be done through the application of restraints to a doll or a stuffed animal. While applying the restraints and periodically during the period of restraints, the nurse should talk soothingly to the child to provide stimulation and diversion. Then sufficient padding must be used under extremity restraints to prevent skin irritation. The ties on restraints should be attached to the crib frame instead of to the crib rails to prevent traction on the restraints or injury to the child when the crib rail is raised and lowered. Restraints must be checked every 15 to 30 minutes to determine whether they are achieving their purpose and whether they are constricting the respirations or circulation in any way. Then education. Explain to parents the need, alternatives, positive and negative aspects of restraints and consequences of not using restraints. Use the parents' assistance to obtain the child's cooperation. Attempt to find an alternative to using restraints. Some options are increased supervision of child by hospital personnel or parents, modifications of the environment, redirection of the child, diversionary activities such as television, radio, preparing the child for a procedure with a simple explanation if developmentally appropriate. Then nursing management. Restraint is necessary at the time to examination to facilitate procedure and treatment to protect infant from harm or injury, but should not for close observation. That time the restraints not needed. Explain the restraints purpose for both of parents and child. This restraints explained by the procedure and demonstrations on doll. Then stimulate the baby during restraints or give diversion so baby do not feel helpless and loneliness. Restraint put effectively so respiration and circulation does not interference. Sufficient padding must be used under extremity restraints to prevent skin irritation. The ties on restraint should be attached to the crib frame instead of to the crib rails to prevent traction on the restraints or injury to the child when the crib rail is raised and lowered. Restraint must be checked every 15 to 30 minutes for our purpose and respiration and circulation. Periodically, at least every 2 hours, the child should be removed from the restraint. Before the restraint are reapplied, the child's position should be changed to improve physiological function and the child feel comfortable. Thank you very much. I hope you have clear with this. If you feel any kind of problem in this topic, kindly inform me. I feel very happy to help you. Thank you.